Well, you know it's going to be a great hour when we have a doctor in the building.
Yes, indeed.
That's for sure.
We're very excited
Dr.
about
Vivek
that.
Murthy, thank you for joining us. But we begin this hour with a major development in the fight against the coronavirus. Pfizer is asking the FDA to authorize its COVID booster for all Americans 18 and older. The shots would even be available to adults who received the Moderna or J&J vaccines. This is Pfizer's second attempt to push boosters for most Americans. The FDA advisory panel rejected its first request in August and limited the shots to people 65 and older and those in certain high-risk groups. But Pfizer says it has new data showing the booster offers almost complete protection from severe COVID. Joining us right now, like I said, U.S. Surgeon General Dr. Vivek Murthy. Thank you for joining us.
Yes.
Hey, I'm glad to be with you all today.
Glad to
Of course.
see you.
Now, let's just jump right in. Pfizer says this new data. It shows that the booster can provide almost complete protection against the COVID virus. Do all adults need this?
Well, it's a good question, and that's what the FDA is going to have to look into. They'll have to examine the data carefully, understand whether giving a boost to that additional group of people that Pfizer is recommending is both safe and effective. But here's what we've seen already from preliminary results from Israel, from their experience. They have seen a significant increase in protection when they've given boosters across the population. But the most important thing we've got to remember right now is if you're eligible for a booster, please go out and get boosted. And if you haven't been vaccinated at all, it is imperative that you get vaccinated because we still have a lot of COVID floating around, and winter is coming, which means that there's a chance that as more people go indoors, there's a risk for spread.
So how soon can this specific Pfizer booster be available?
Well, the FDA will have to go through their process. They've been prioritizing vaccines, so I imagine potentially in the order of weeks, they will make a decision around this. But again, it depends on what they see when they look at that data.
Yeah, Pfizer had tried to get this done back in August, September, based on what was happening in Israel. So hopefully it'll be sooner rather than later. Can we talk about the misinformation that's out there about the vaccines? You know, we've got the big story in the news about Aaron Rodgers, who seems to be using his platform to spread misinformation. How do you deal with that? What are your thoughts about that?
Well, Gayle, I'm glad you brought it up because health misinformation is one of the greatest threats we have right now in our COVID response and more broadly for health. It's one of the reasons why in July of this year, I issued a Surgeon General's advisory on the dangers of health misinformation. It's also why yesterday I actually also followed up by issuing a community toolkit that families can actually use, that community leaders can use to give themselves training and tools to actually fight misinformation in their own lives. But this is a fundamental problem because I think people have the right to make their own decisions, but I also believe as a doctor that they have the right to have accurate information, so they can make the best decisions for themselves and their families.
That he's allergic to something that's in the Pfizer and the Moderna vaccine. Have you heard of people being allergic to anything in those?
Talking about Aaron Rodgers?
Yeah. Yes, Aaron Rodgers, yes.
So there is a very, very small number of people who may have an allergy to one of the components of the vaccine. This is very rare, though. And in those cases, then they can talk to their doctor and they can look for an alternative vaccine. But again, this is exceedingly rare. One of the things I think to draw, though, from this whole example that's been talked about more recently is that who you get your information from really matters.
Yes.
Because somebody has millions of followers, in social media, because they happen to have a well-known name, does not mean that they are a credible, authoritative source when it comes to vaccine information. And especially now that we have a vaccine that's out for kids 5 through 11, it's especially important that parents know that there's misinformation out there. They talk to their doctor, their Department of Health, their children's hospital, or the CDC to actually get credible information about the vaccine.
So, Doctor, on the subject of credible information, accurate information, I'm a big believer in the idea that the American people can handle anything as long as they know what to expect.
Yes.
So on that point, what should we expect medium to long term from the coronavirus? Is it now time? Can you tell us and acknowledge that this is going to be around? It's never going to be eradicated. And at some point, we're going to have to just be living with it.
Well, great question. As we look to the future, I think what is likely to happen is that there will be coronavirus around for some period of time. But I do think we can knock it down in terms of its severity. And second, we can reduce the number of cases. So we can get to the point where we live with it just like any other respiratory virus. That's where the vaccines have been so helpful. Keep in mind, if you look at the Delta wave we experienced over the summer, the vast majority of people who had severe infection, were hospitalized, or who died were people who are unvaccinated. And that means, again, and tells us that these vaccines are remarkably effective. We also have 2 new oral medications that are on the horizon. The FDA has to review their data, but the initial trials showed that they were very effective for reducing hospitalization and death.
So it'll be around for some
good news to come.
Good news to come. And you said COVID will be around for some period of time. I mean, should people be prepared for that period of time to be forever?
Well, I think we can certainly learn to live with it. Like, think about the common cold, for example. Like, we have learned to live with the common cold, and we can take precautions to protect ourselves, but we know how to get through it. We can ultimately get COVID, I think, to a place where it's somewhere in between the cold and the flu, where, yes, it's a virus that's circulating, but it doesn't disrupt our way of life, doesn't prevent us from seeing the people we love, doesn't prevent our kids from being in school.
Okay, Thanksgiving coming up. Should unvaccinated people be fraternizing over holiday dinner with vaccinated people? Would you do that?
Asking for a friend.
Asking for a friend wearing a blue dress, yes.
Well, look, I think if you're gathering indoors with vaccinated and unvaccinated people together, that is certainly a higher risk situation, especially if you're a parent like me and you've got unvaccinated kids at home because they're not eligible yet or they haven't gotten a vaccine yet, then you want to be especially cautious. So the other thing, though, to remember is there are steps we can take to reduce risk further. Wearing masks indoors helps. Using testing strategically can also help to reduce the risk of people coming to a gathering infected.
All right, and children can be vaccinated over the age of 5. That's coming.
We need you to come back. I got a lot.
Yeah, you need to.
Yeah, we got a long
Can
list
get
here.
vaccinated from 5 to 11. It's a
Glad to
big,
see you in
big
New York.
win,
Yeah.
especially
Big
for kids
win.
like mine. I've got a
Lots more
5-year-old
questions.
excited
And your
to get
child
him
will be
vaccinated.
vaccinated. It would be a problem if you said, no, I'm not vaccinating mine. So it's good. That would be a problem. That would be a problem. It's so good to see you in
Yeah,
person. You're
welcome.
a real boy. We only see you from the So nice to see you. Thank you very much.
So good to be with all of you.
Vivek Murthy.
Take care.
Thank you.
you.